So Ruth, in terms of breathing low, it's very important, and low breathing basically means that we just have good recruitment of the diaphragm. So for example, we are either breathing high, where there's greater movement from the upper chest, or breathing low, that we've got good recruitment of the diaphragm. It's very important for a number of reasons, and especially from an emotional point of view, because of the connection between the diaphragm and the emotions. So the instruction to take a deep breath is actually correct, but the interpretation of it is often incorrect. Now we're going to do some deep breathing the proper way, as opposed to how it's interpreted. Deep breathing should be silent. It should be in and out through the nose, and it should be driven from the diaphragm. So I'd like you to start off by just putting your hands either side of your lower ribs, like this. And if you can have your hands to your sides. And as you breathe in, the objective is that you can gently push your ribs outwards as you did. And as you breathe out, that your ribs are moving in. And now to do it with silent breathing. So there's your breath coming in, and there's your breath leaving. And that looks really good. I can't hear you breathing. As you breathe in, your ribs are moving out. And as you breathe out, your ribs are gently moving in. So it may be also helpful just to look down. So the objective is to keep the chest still. So as you breathe in, your ribs gently move out. And as you breathe out, your ribs are gently moving in. So there's your breath in there, and there's your exhalation there. So that looks really good. So we always go by the 80%-20 rule. 80% is driven by the diaphragm, and there's always going to be some movement from the upper chest. That's normal. So as we breathe in, are we able to push the lower ribs outwards, which is a good gauge of the generation of intra-abdominal pressure. So as you breathe in, do you feel your ribs moving out? And as you breathe out, do you feel your ribs gently moving in? And there's your exhalation there. And as you breathe in, do you feel your ribs gently moving out? And as you breathe out, do you feel your ribs gently moving in? And even to practice this for a few minutes here and a few minutes there, and go for a walk with nose low, slow breathing, but also if we're getting a little bit stressed, check in. Where are we breathing? Are we breathing fast and upper chest, or are we breathing low and slow? Because when we breathe low, we tend to breathe slow. And low and slow breathing is a calming mechanism for the body and mind. So we can take a rest of that.